That's so promising, doctor, because I can tell you as a psychiatrist, we see countless patients who we get from primary cares or other specialists and say, my doctor said it's all in my head.
Right. Right.
And what you're saying is it's not necessarily.
Absolutely not. It's a very physiologic condition. Yeah, certainly you look at stress will make it worse, but you look at stress, lowers pituitary function, lowers immunity, so and that it causes the infection to flare and it causes the hormones to be lower. So there's a physiologic basis for it, and certainly they're going to be depressed because any chronic illness, there's going to be depression as a variable and a compounding factor, which exacerbates the condition, but it's generally not a primary depression, and it's a cop out. Oh, you're just depressed because again they can't find anything because they don't do the right tests and they can't treat it, so it's the patient's fault.
And the poor patient just keeps saying, "Yeah, I just want my life back."
Oh, exactly. And for instance, the worst place to go when you have a diagnosis is the emergency room, and patients go, "Oh, they're just treated like drug seekers." And they're treated like lepers, and because no one feels they can do anything for them. But in our centers, we've published our data. 90+% of patients get significant improvement, and so there is really hope and for these patients that when you find the underlying cause and treat it, there's really benefit almost without exception.
Doctor, that gives our listeners a lot of hope. First, I really believe we need you testifying in Congress, okay? When we have our chance, we're inviting you. Somebody somehow needs to listen and understand what's going on. But it sounds like your website is full of wonderful information. Can you give us that again?
Yeah, it's www.holtorfmed.com, HOLTORF med.com. We have a center here in Torrance and also in Foster City, which is by San Francisco. We have patients come from all over the world now, actually, and a lot, interestingly, from Canada and England. You know, they're supposed to have everyone's covered, but really their care is probably worse than it is here.
And that's a sobering word because we hear a lot about this push for government-run health insurance, single-payer, universal health care. But what I'm hearing from you is beware with that model.
Really, that is very true. And models like that, like Kaiser as well, they're pretty good if, let's say, you break your arm, something very straightforward. But as soon as it's outside the box, the system really breaks down.
Right. Well, Doctor, we want to make sure our listeners have your website because you've got incredible resource and hope for our patients, and it's www.holtorf, HOLTORF med.com. Is there any other number or book or information that you want to leave for our listeners?
Well, there's a lot of studies up there and a lot of information that I think can be very helpful.
Wonderful. Some final words for our listeners?
I think you really hit the nail on the head, and really prevention is the key. And when you get these conditions that they're chronic multi-system illnesses that really poorly treated in Western medicine, including fibromyalgia, chronic fatigue syndrome, these hormone imbalances, really seek out a physician that's knowledgeable, and it's unlikely going to be in your HMO and your Kaiser physicians, unfortunately, but they're out there.
That is wonderful. Doctor, I want to thank you. You've given us a real message of hope and for your pioneering work. We're with Dr. Kent Holtorf, and this is Dr. Mary Zenit on Health Matters, because your health matters. Thank you.
Great, thanks.
Thank you, Doctor.
Great, thank you.